Fantastic.
Hi, Dr. Ravindran. How are you?
I'm all right, Blair. Thank you.
I'm just a huge fan of your book, The Pain Free Mindset. And
Thank you.
I, I feel like this book needs to be a prerequisite for every medical student. Um, and it's amazing that the content and information in there, which I am encouraging every person listening to this to go by as your guide through everything, because it's all the resources that we don't get um, from medicine to date. But I wanted to ask you, how did you end up in this field? Chronic pain is such a personal experience to me, and I know to over 100 million people in the US alone, if not more. And I'm just curious to know if you have any personal tie to that, or what got you into this field.
Uh, well, first of all, thank you, Blair, for having me on your podcast and for giving me an opportunity to speak to the audience across the pond, really. Um, in response, probably with regards to pain in itself, no, I wish I probably had that kind of a background. I would have to say that some of it is been in response, maybe the deeper understanding of biology and pain itself, and misunderstanding, if you will, which a lot of us in pain, and I see that in my patients, occurred way back when I was in my teen years when my grandfather in India. So I grew up in India, and my grandfather fell ill with a cirrhosis of the liver. So he was investigated initially, and then after investigation, it was found that he had a cirrhosis of the liver. And in India, the default is that if you have a liver cirrhosis, it's assumed that it is because of alcohol. And my grandfather was an absolute teetotaler. He was a devout religious man who never had a drop of alcohol his whole life. And that in itself was like him trying to almost convince others that he doesn't know how he had it and it's not him to blame. Nobody can see why it happened. There was no explanation for it. And it was only after, I think, about 4 or 5 months later did somebody tell him that he had tuberculosis a few years prior, and that activation of the tuberculosis and getting treated with tuberculosis treatment, the drugs they give for treating tuberculosis, they can have a side effect rarely of causing liver damage and cirrhosis. But that had made my interest in sort of biology at that time. I was in my GCSE, sort of what would be 10th grade at that time. And it's when I got the interest in biology, when I got interested in pain a little bit, but I kind of navigated into medicine and into anesthesia when I was doing my graduation in India. And I came to the UK as well, very much interested in anesthesia, but also wanting to do some research or some kind of fellowship in pain. And so that's been my journey, is coming from the background that I wanted to do some studying further in pain, wanted to more specialize in pain, because the idea was that at that time, and it was an exciting idea around the late 2000s, was that there was these new interventions coming. This was still the time when opioids were considered to be decent and supposed to be good for pain management, and there were some new opioids possibly likely. So when I came into with the interest in pain, there was a lot of opportunity to say there were some new techniques and new procedures that might make a difference for pain management. And that's what sparked my interest in pain, really. And that's why I did the fellowship in a very prestigious part in the United Kingdom called the University College London, and in a very tertiary place. And then I also did some part of my training in Oxford. So that's how I got my training in pain. And I started as a consultant doing both anesthesia and pain management, which is the same in the US as well. Most pain specialists do have a background in anesthesia, but in the UK, it's predominantly 95 to 98% of doctors in pain management would have a background in anesthesia. And I think that's been my journey into pain, particularly. I wouldn't say it's personal experience other than what I've seen through my family's eyes in how people look at a condition that can't be seen but people suffer from, to where I am now.
I think it's so interesting and kind of spot on that your grandfather had this experience of something being wrong and the medical community looking at him almost with accusatory eyes. And I think, as someone who has been um, dealing with chronic pain myself for 30 plus years, I want to ask on behalf of all of us who go through this a very big, kind of broad question, but why do we hurt so badly when it appears that nothing's wrong with us? So, as someone with chronic pain, speaking on behalf of the 100 million plus, people in the US alone, the pain, the physical pain that we feel, I'm sure runs the spectrum, but is so real and so intense. And we go to a doctor and we get that accusatory eye, and so many of us get that response of, there's nothing wrong with you. We've run the tests, we've done x-rays and MRIs, and nothing's wrong with you. And we know that something's got to be wrong. So can you walk us through that?
Yeah. I think it's such a fundamental question, Blair, and it's such an important question as well. It's the most common question that everybody asks me in the clinic when they come referred from the orthopedic consultants or the neurologist or anyone that they have seen before, the rheumatologist. And it actually boils down fundamentally to this disconnect in how we now understand pain versus how we've been taught to think about pain within the medical profession and in society for probably the last 300, 400 years. So that disconnect is what's coming to light now, and it is being better understood. Probably 20 years or 30 years ago, that disconnect would mean that a lot of primary care physicians or specialists, once they have done the structures, you're left, the patient is generally left struggling to make sense of it. Now we've actually got the research to say what's actually happening, and in a way I can maybe use this opportunity to actually say about the definition of pain as of 2020 from the International Association of Study for Pain. That's like our major flagship organization that's based in Seattle. And they have actually defined the sort of new definition is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. So, what they're actually saying is you don't have to have tissue damage. It can be just potential tissue that feels like damage. It can resemble that. But the main point I want to bring to your listeners and to your sort of attention, as it were, is that word of sensory and emotional experience. So, right from the outset, the sensation and emotion are both intermixed, and to a certain extent we have to think about pain in both those contexts. What actually happens for the last 400 years and the way the medical professionals are taught about it and society thinks about it is that they always think about pain as a sensation. And that has been the challenge, because when it is a sensation, medical professionals think and they do know that you can actually change sensation. You can numb it, you can block it, you can probably even cut it out. And that's led to a lot of the medical advances in the last 300, 400 years. Is if you think of pain as a sensation, then you could probably say, yes, we can do all of this. But once you start to think of pain as being an emotional experience as well, then you realize that the tools that we have right now, x rays or MRI scans or CT scans or injections or nerve blocks, they are not meant to dampen or cut emotions out at all. And that, to me, I think is a very fundamental reason for why we need to look at other ways of explaining pain that is persistent when you don't have a structural cause, like the way you said, when people don't have a structure to account for it. How do you account for the intense pain that 1/5 of the world's population is suffering from? Then you need to expand your frame of reference and say it's not just a sensation. What if it's a sensation and emotion mixed together? Now, what are the opportunities that you have in terms of reducing it?
So I think that there's something really big here. And I want to kind of pull this out and look at this. Um, I think for a lot of people, hearing that there is an emotional element to pain is is an aha moment. And I know for me, it certainly was. Like I said, I've been dealing with this for 30 years. It wasn't until about 3 or 4 years ago in my reading, because I was trying to figure out what was wrong with me because no one else could, that I came across uh, actually Bessel van der Kolk and The Body Keeps the Score, and understanding that emotion does play a role. So, can you talk a little bit more about, you know,
That aspect there,
how
yeah.
how
Sure,
emotion
absolutely.
or
Absolutely. I think it's very important, as you say, to unpack that a little bit more. And indeed, the IASP, the organization I told you about who defined pain, they actually realized that their definition was a bit clunky. And so they actually, if your listeners were to go to their website, they'll actually find that there are six kind of qualifying statements that they say, and I'm just going to probably highlight two or three statements which will give you and your listeners that link that I was talking about. So actually, one of the first things that they say is pain is a personal experience, and it's influenced by biological, psychological, and social factors. So that's the first statement, wherein they actually say, yes, the biology, meaning the structure, could be implicated, but there is a social element, meaning that the system in which people live in, the society that we are part of, could have a role to play. What is the psychological element? The individual personality, as well as the influence of other people around them, could also have a role to play. The second thing that they talk about is this distinction between pain and nociception. And what they say is that when the nerves in the periphery or near a joint are injured, or there's a surgery, or you have a hurt, or you have a swelling of your knee joint, those nerves around that area will get triggered and activated, and chemicals might be released. That phenomenon is called nociception.
I'm sorry to cut you off, but I think for people listening, I want to give nociception like a clear, concise uh, description. So nociception is actual harm or injury to tissue.
Absolutely. So when you have chemicals that are released at the site of any injury, whether that's something that you have on a hockey field or a football field, whether that's something that happens after a road traffic accident, or whether that happens after a surgery, or that happens when you have an autoimmune condition like rheumatoid arthritis and you have a flare up and you can see your joint swollen, it's red, your blood test might show signs of inflammation. That is nociception.
That's the
But
physical evidence
that's the
of,
physical evidence of
of
injury
pain.
or harm.
Right. And then
And then when that signal or those chemicals and that information is carried in the nerves to the spinal cord and then to the brain has to understand the context. It has to look at the signals coming in and make out where you are. It's got to figure out where you are. If you're on a football field and you have a knee injury, that would be different from you might be on a busy road and you hurt down and you hurt your knee on a road and you see a bus coming towards you. The knee injury is the same. The nociception is the same because the injury might be the same, but the response to it and the intensity of what you need to do will vary very widely, whether you're in a supportive nice environment like a football field where everybody's egging you on and you're part of a team, or whether you're in a road needing to get out of harm's way. That experience of pain is something that the brain decides based on the context, based on whether you're being protected, based on your previous experience of having been in a similar situation. So, if you have a knee injury on a football field and you know that in a football field people are prone to injuries, the brain would make a different decision than if you were going on to a new place for the first time and you've had a knee injury. The brain would make a different decision because it's all unfamiliar. So the experience of pain is very different from the nociception. The physical injury might be the same, but the intensity of how hard or how horrible it feels is dependent on context, on past predictions, and on expectations and on support. So that sum total of all of that is the pain experience. So pain and nociception are very different. And in modern medical science, that's another problem that your medical professionals in the US, in the UK, and all over the world, we've all been taught that pain and nociception are the same. So we use the same tools for nociception and we try to think that it'll work for every pain, but it doesn't.
And so when you're giving that example of the football field and the road, that's tying in the emotional aspect, right? Of so the nociception, again, to clarify, is the physical evidence. It is the swelling, the tissue damage, the things that do show up.
Yeah.
And that elicits a pain response. But the emotion is tied into a different response from the brain, which is if it feels safe, if it feels like there's support, if it feels like I'm not in danger, this hurts, but I have all the tools here to be tended to versus being in an unsafe place like the road. It elicits a different response.
Absolutely. And this is how wonderful the nervous system and the brain is, that it is able to make that kind of decision making based on context.
So
And
if we feel safe, our pain is less. And if we feel unsafe, our brain emotionally, if we feel unsafe emotionally, our brain will register more pain. And
absolutely.
so this ties us into like a whole different element. And this is you know, the aha moment. I think that there's a bunch in here where pain is tied to emotions and trauma. And um, I'd love to talk a little bit about is that the hidden purpose of pain? You know,
Ultimately, I think that is where the research is now at present. The research is now indicating that pain, as we understand it, the whole experience of pain, is essentially about the brain trying to protect us. And it
and what
is
is
an
it protecting us from? Is it
so
protecting us from our emotions? Is it protecting us from trauma? Is it
so the present way from research to think about it is that the nervous and the immune system are constantly talking to each other. And throughout the animal kingdom, these nerves and immune cells are in constant cooperation to ensure the survival of the organism. In the humans, the extra layer of complexity is added because we, for the first time, are conscious beings who are capable of thinking about the past and the future and reflecting. This particular combination of the nervous and immune system is essentially using the mechanism of pain to decide how to ensure our survival. It makes some predictions based on its past experiences to say, this is what helped us survive the last time by doing A, B, C, and D. And it decides that that's a suitable format to apply for every future occurrence until otherwise, until proved otherwise. So it's kind of got this prediction model to say, I did this at the age of 10, and this is how I protected Blair when I wanted to protect it. And I brought the systems forward to tighten the muscles, to make everything go tight, to bring about the experience of pain. And this has helped me protect Blair at that age. It then becomes a model that it would use in its 20s, 30s, 40s. And as long as it feels it got to do it, it will use the same algorithm. But what might have been protective for someone at the age of 10 for a particular context need not be the same at the age of 20 or 25 or 30, but the brain and the nervous and the immune system get stuck in that loop. They don't get the chance to update the models and say, you know what, I don't need to protect it every time. I can probably learn a different way of managing it. And this is where we are discovering that some people are able to do that, what's called the post traumatic growth. Other people take their time to arrive there. And for some people, it's very difficult to get to that state because they just get stuck in that loop of the original protective cycle ongoing. And pain essentially becomes the medium through which the nervous and immune system continues to exert its protection.
so it becomes a an instruction manual that no longer serves us.
Yes, the
And
protection is overprotective and unnecessary for every kind of context, but somehow it seems to think that when you have stress from having a rent problem in the house, or when you have a problem with your partner or your child, or from your workplace boss, or from your situation at home, or from the war somewhere else, it seems to just want to bring the same response, even though each of them are separate contexts.
so we feel physical pain as a result of emotional or a stress response.
It is at a biological level when you feel an emotional or stress response. It means that your certain nerve circuits in the brain and in the nervous system are becoming either hypervigilant to want to protect you. The way they action that protection is to release adrenaline and cortisol because they think you either got to fight or fly. And now we are realizing, thanks to theories like the polyvagal theory or Peter Levine's work, is that there is a third or fourth aspect that can come, that the nervous system and the immune system, when it feels that it can't fight or fly, it's going to freeze or might even flop. So when people have that response of a rabbit in the headlights and they just go tight completely, the muscles go into extreme spasm and they just can't move, or they actually lose their sensation of their arm or their leg, or they fall unconscious, these are all considered to be an extreme over response, an overprotective response of the nervous and immune system to a threat that they can't otherwise actualize. But the first two parts, the fight and the flight, are the reasons why the emotional parts can often be felt physically in the rest of the body. And a lot of people will say, well, yes, I have a panic attack, but my pain became much worse. But that's because we have never really taught everyone in society that pain's always a sensory and emotional experience. So people often say, well, they're emotional, but their pain in the body must be because of something else and not necessarily related to the emotion. But everybody understands that stress makes their body go tight, or their irritable bowel get worse, or their muscles get tight. But they often try to draw a distinction between the back pain and the neck pain versus the pain that they feel when they get stressed. I think that's, it's difficult to explain why that happens, but that's exactly what happens. I think, as it might be in your experience, but certainly a lot of patients in my clinic, I can sense that they say and they completely agree that stress makes their pain worse. But it's also to realize that this is the fight and flight response that played out in the body, because every time you feel anxious or depressed and your fight and flight response is activated, it means the muscles in your body have got to be ready to either protect you by flying or fighting.
And I think that it's something that we kind of operate from without even realizing it, right? So if there was chronic pain starts somewhere, it could have been from a physical injury, or it could have been from a traumatic emotional situation where, like you said, we get stressed and we kind of lock up, and it creates, it's something that keeps repeating. And I think so many of us don't connect the dots, right? And this is why I wanted to create Healing Power Growth, is to connect the dots, to connect the brain body experience. Is that the the world that we live in now, it's just, we're all under stress all the time. It's become, it's like, we used to be calm and then have scenarios of stress, and now it's living in stress with scenarios of calm.
Correct?
It's completely flopped. And so I think, as a as a people, I don't know how else to say it, as people suffering with chronic pain, and we we forget that this is the reality that we live in, and we are so disconnected from our bodies and the experience that we live in, because stress just feels like the new normal.
Absolutely.
So I think that this kind of brings us into um, mindset and lifestyle, and how mindset and lifestyle affect pain. Um, and I would love to, I don't want to get very scientific, because I don't want you know, I want this to be really manageable for all of us that are listening and have actionable, understandable takeaways. But if we could talk about how um, mindset and internal self dialogue and lifestyle affect pain for the better or for the worse, and are there actionable steps or things that people
Do.
can
No,
do to help
I think
alleviate?
that's why I wrote the book, because I found myself learning about it myself in about 2012 or 2013. So when I go back to sort of the original story, I started as a consultant in 2010. So, having fully finished my training in pain medicine, equipped with the knowledge, thinking that medications and interventions would be all that's required to help people in pain get better and overcome their pain. I realized within the first 2 or 3 years, i.e., from 2010 to about 2013, that my medications weren't working in more than 30% of people. That's it. The injections I did not seem to last longer. There were a select few patients wherein it really changed their lives and made a difference. And I realized on retrospect that those are the people in which nociception was the predominant problem. So the injections obviously worked. But for a lot of people, almost 60, 70% of my patients, the
So
tools.
I just want to clarify something here. So you're saying for around 30% of your chronic pain community that you deal with, they responded to medical intervention because that was they were dealing with actual tissue damage pain. And so for tissue damage pain, medication works. But for anyone else, but I think this is the thing. Most doctors aren't on this bandwagon yet. So there's this 70% of the population that is not responding to pain medication. So what the hell's wrong with these people? And what you're saying is this is an emotional issue, like a trauma issue, or a mind, internal dialogue, or something that is outside of a tissue damage, but that is causing us pain.
Yeah,
And
absolutely. So even the exactly, I think in simple terms, that's exactly right. So in about 20 to 30%, there would be some active arthritic change or a disc that's releasing chemicals that's actively irritating the nerves, causing sciatica like symptoms. So that's there. And for them, medical interventions, whether that's tablets or injections or maybe even surgery or infusions, can make the big difference. But even in those patients, once you go beyond 3 months of time, the nervous system is starting to get sensitized. So, the one extra thing that I would add to your internal dialogue or the emotional element is that ultimately it's the signals got to travel in the nervous system, and the nervous system and the immune system can work themselves up and amplify the chemicals that go within that system faster and faster and better and better. And what we've realized, and what I realized when I did the reading and the research before writing my book from about 2014 to maybe 2017, 18, is that once you start asking the question, how do I calm the nervous and the immune system down? That means it opens up your opportunities of how you can make a difference, and you realize that you don't need the medications and interventions in every one of those cases. And
can you
that's what I
please
mean
say
by the
that
change in
again?
mindset.
I want people to hear that again. Can you please say that again? That by calming,
Yeah. So the question I'd like your listeners to think about is that Once you've gone beyond the first 3 months of having nociception, i.e., a pain that can respond to medical interventions, beyond 3 months of time, the main question that your listeners need to be asking themselves is, how do I now calm my sensitized nervous and immune system? Because that happens in almost everyone. And that means that your frame of question should be, well, what can I do to calm the nervous and immune system down? Once you approach it from that frame of question, you realize that that is the mindset shift I'm asking my patients in chronic pain, my colleagues in other fields who help chronic pain patients, is to reframe the entire dialogue of treatment as, what can I do to help this person's immune and nervous system to be calmed? Which means that if there is nociception, absolutely pull out an injection, pull out a surgery, pull out a nerve block, take out a medication from your cupboard and try it. That's absolutely fine. But when you don't have that evidence, you still don't have to be stuck to saying, oh my God, there's nothing else to do. But actually, the evidence and the research now says that there are other ways to calm the nervous and immune system down. So my question
Tell
and
us what
my
they are. What
hmm?
are they? What are
That's where it comes to it is, so the first part of it is just changing the mindset to ask the question. The second part is
so the first part of changing our mindset is to get curious, you're saying.
to get curious and ask that question, how am I going to calm the nervous and immune system? That would lead you to actually say, well, what am I going to do? What am I going to try? And that's what the rest of my book kind of talks about. And effectively, that's what a lot of specialists who practice lifestyle medicine and integrative medicine or functional medicine, that is the approach that they all come from. How can I calm the nervous and immune system down using non medical or non drug techniques? And the research points to modifying your stress system, because that changes your cortisol and your hormones, your adrenaline, all of that bit. So that's stress reduction techniques, what I call as neuroscience. Modifying your diet and nutrition, because that's a powerful way to calm your immune system down. Modifying and optimizing your sleep, which helps in calming the nervous system down and helping it clear of its waste. Embracing physical activity and movement, because that dampens the nervous system and builds new nerve circuits. And a variety of other mind body therapies, whether that's a trauma therapy, whether that's acceptance and commitment therapy, whether that's CBT or a behavioral technique or yoga or Tai Chi. Any of those techniques have a dual effect. They calm both the nervous and the immune system down. So you can see that these are the five kind of broad things which can calm the nervous and immune system down effectively. The challenge for a lot of us is the evidence for it is not of the nature wherein right now a medical professional or anyone else cannot look at someone like, for example, like you, and we can't know at the outset that this kind of technique will work for you, i.e., a combination of sleep and physical activity will work for you more than stress reduction versus for someone else. So, that kind of personalization according to the patient, that's what we've not reached as yet. We are getting to there with the evidence. But right, this is where what I mean by the lifestyle approach is to bring that element of five aspects of neuroscience, stress reduction, sleep optimization, nutrition, physical activity, and mind body techniques. That is the overall toolkit and sort of backpack that I talk about in the book and what I mean by lifestyle.
Just because food is such a big deal. And I think that there's definitely like an undercurrent. I see people, being more mindful of how they're eating. But I also think, again, because of the volume of people that we're talking about and food scarcity and all kinds of issues of, you know, getting organic food is expensive and that's not something that every family can do. Can you just unpack a little bit um, food and how that negatively affects our pain response?
Yeah. So, one of the big discoveries of the last 10, 20 years is this particular concept of what's called the microbiome. And the microbiome is a word that is used to describe the sum total of all the tiny microorganisms that live in and around us. So they live in our intestine, right from our oral cavity back to the back passage. They are a combination of bacteria, viruses, other tiny microorganisms in there, parasites, and these are all living within us in various parts of the intestine and on our skin and in our vaginas, in our oral cavities, in the ears. So they have been there with us and evolved with us. And for a long time, we just thought that these were unnecessary things that are meant to be got rid of, or you can take antibiotics to get rid of them because they were all bad. But in the last 20 years, the research has shown that actually the reason we are a super organism that are able to think like this and be like this and the way we are is because the genes and the information from these tiny microorganisms that live within us in our intestines, those are talking to the immune system that we have that is there in the intestine. And it's this combination and this crosstalk and this information transfer that's actually making us much more intelligent than every other living creature around us.
So
So
we're
that
our own ecosystem.
absolutely. So our ecosystem that lives within us and around us, and the sum total of all the genes, that's called the microbiome. And what we've now found is that in the intestine, like in our intestine that we have, imagine that there's just a single brick wall. So imagine a garden where you have just a single brick wall, and on one side is your immune system with all the immune cells that are like your border security force. And then on the inside, on this side of the brick wall, are all of these microorganisms with their chemicals and their genes and their information chemicals. And right now, they are talking across the brick wall. They're sending tiny packets of information, giving information about the lumen, about your gut to your immune system. So, your immune system is actually monitoring all of this information and then using the vagus nerve to send that information back to your brain to say, actually, is all good? Is it all right? Is all well? And that means that your immune system in the gut is also giving information about your safety, about the internal safety to your brain and helping your brain make decisions. And that's what we've realized now, that that immune system is maximally present in your gut and around there. That means that if the food that you have is inflammatory in nature, so a lot of ultra processed foods and processed foods actually provoke inflammation because your healthy bacteria and viruses on this side of the brick wall are saying to your immune system, that isn't good stuff, that's bad stuff, that's actually making me inflamed and I'm dying. And that means that the immune system thinks, oh my God, that's danger. I need to give this information to the brain that it's unsafe because of what's eating. And that's what we've now found, that some foods are pro inflammatory. Lots of ultra processed and processed foods are pro inflammatory. And all of that information, so how you eat, what you eat, when you eat, how much you eat, all of that is constantly making conversation between your immune system and the microorganisms on this side of the brick wall. And that means that by changing the type of food that you eat, or the time you eat, or how much you eat, you could potentially give the information to your immune system to say, calm down, it's all good here. And your immune system could actually tell the brain, it's all okay here. And your nervous system could say, yes. And so that means that the overall intensity of pain or other symptoms could be a lot less when the kind of food that you have is anti inflammatory, is probably predominantly whole food, and contains as little processed food as possible.
So it sounds like by what we eat, we can not only adjust our inflammatory response and our chronic pain, it reduces stress and anxiety, which are also contributors to the pain, or maybe that's the reason why the pain is going down in the first place. And that also affects our mood, because if we're not feeling as anxious or inflamed and in pain, we have the ability to feel like happier emotions. Because I know when I'm in a chronic pain flare, I'm I'm not feeling like my happy self. That just doesn't go together. Food is the drug.
It is indeed. And that's, in a way, Blair, you've perfectly hit the nail on the head there. So, two parts answers to your question. One is, we've now actually got a lot of good evidence in mental health problems like anxiety and depression around the role of food and mental health, to the extent that in the United Kingdom now, and maybe it's also happening in parts of the United States, that we've got campaigns in the United Kingdom going on calling food for mood, to actually say that the evidence for antidepressants and a lot of mental health drugs isn't great. We actually should be thinking about a variety of foods that we should be introducing and encouraging patients with anxiety and depression to consider, because when you take the right kind of food, your mood changes and you don't need more drugs to manage it. So that campaign is going on at a national level in the UK. So I wouldn't be surprised if that kind of evidence is also there in the United States if it's happening. So that's the first part, that we have now realized the connection between food and mood. But in answer to the second part, where you say food is a drug, in a way, when we do feel distressed, when our nervous and immune systems feel a bit unsafe, it has actually coded in a way to reach out for the kind of food that gives it a feeling of temporary safety. So, in a way, when you take processed foods that are having rich in sugar, that sugar, while being pro inflammatory or provoking inflammation in the medium and long term, in the short term, that sugar eases the reward pathway. It satisfies the reward pathway in the brain, and it kind of calms us down and soothes that part of the nervous system that is feeling on edge, which is why a lot of people end up binge eating on chocolate, on ice cream, on
I was
donuts,
going to say, so
everything.
it's really interesting. Like, we go for the comfort things, right? When life is hard, when we have the breakup, the broken heart, the fight with someone in our family or one of our friends, or a shitty day at the office, and we're like, I can't wait to get into a pint of ice cream. I can't wait to pour myself a drink. I need a bag of chips, whatever it is that's like that comfort go to food is in that moment. It's comfort because it's elevating, you're saying, a chemical system within us, which in the short term makes us feel better. But then afterwards, it's kind of like buyer's remorse. It then sets in with the like, ugh, I feel like shit. You feel like, and then it creates just a like a crappy feeling of, you feel kind of heavy and lethargic, and you start beating yourself up emotionally, and I'm sure it just all kind of, you know
It
circles
becomes a
circles
vicious
from there.
circle. And And I don't think it's very difficult for most of us to exert that kind of higher control. So while I'm telling your viewers this and your listeners all of this stuff, I know that when I do feel stressed, I can't help but reach out to a chocolate or something that's just going to give me that feeling of calm. So I very much realize that these are hardwired responses that humans have as part of evolution, which I think are going to be very difficult to completely eliminate. I think as long as we recognize that these are happening and you can have
it's about
ways to manage it,
awareness.
then that's okay.
And it's just about being mindful and aware, right? And again, I keep going back to connecting the dots. So I want people to like take away that you're not, yes, you have to be mindful of your food, and I guess those things are true. You are what you eat, and food is, food is medicine. And we now have the scientific research and studies to show that, like what you're saying, that food, proper food, nutrient dense, whole food, unprocessed food, has better results in dealing with depression and anxiety than the medications themselves.
Absolutely.
And so I just, everything that I want people to take away is that, we're so used to having pills thrown at us, right? We're always dealing with the symptom. And I'm all about healing power growth, is all about dealing with the root cause. Because when you get to the root, I say you can pull out the weeds. And
Yes,
there's so many amazing points that you've brought up just, within this food realm. But I also wanted to ask about the activities, because you were saying, to move, and that is really important as well in breaking the chronic pain cycle. That food is just one of the 5 things. And one of the things that I struggled with, and I am sure this is something that so many of you out there also struggle with, is that when I'm in a flare up, or before, like there was a period where I never wasn't in a flare up. It was just every day of incredible pain. I've now modified my life and I live lots of days without pain.
wow.
And then I have flare ups. And I guess there's 2 questions that I have, and they're tied into one another. One is, when you're experiencing chronic pain, how is it that we're supposed to tell ourselves to move when you feel like you can't get out of bed? So, like, I know in your book you say, um, even in chronic pain, like, we should be moving every day. And can you talk us through, or give us, like something that's like bite size and hopeful, because sometimes it just feels like getting out of bed is more than you can handle.
Absolutely. And I think it's such a good point you raise. And I want to be completely sort of transparent on this part here. I don't think anyone has cracked that nut as yet on how you can get chronic pain patients to move comfortably. It's going to be tricky. There's no doubt about it. And what I'm about to suggest is a set of techniques and suggestions. And part of it, which I talk about in the book, and I call it kind of the exercise mindset, is essentially that first, that gentle shift in your outlook, that if you're in chronic pain, yes, any movement is going to feel more painful. So the suggestions I make are a few. First of all, there is now the evidence to actually say that visualization is a powerful technique to start with. So, in the first instance, you don't even need to move. So, there is a particular kind of mind body technique called Tai Chi for tomorrow or Tai Chi for well being, where these instructors have modified Tai Chi in a sense that you do very little movement, or you just close your eyes and you imagine that you're doing the movement. In some ways, doing that visualization technique itself almost teaches your brain and your nervous system that it's okay to do it. And if you've been able to do that without pain or with less pain, then when you actually start to do it, even if it is for 1 minute or even 2 minutes, then it's likely to be less painful or going to be not as sore as it might have originally been. So, the first step I'd say is consider visualization techniques. The second step is to start in really small amounts. So, when you said bite sized, I exactly would echo that. Small bite sized movements, and doesn't have to be a movement that you don't like or you haven't done before. So go for a movement that you have tried before so that you know it's been safe to do without hurting anymore. So a bite sized movement, a movement that is safe to do, visualizing it first, and then when you start doing it, if you actually can do it with someone else, someone you trust, maybe someone who can support, then that is added because you also have a mix of part accountability but also part somebody supporting you as you do that movement. And that, I think, is just the smallest of starts, which I find most people can do. When I talk to my patients and suggest them and ask them, they say, oh, no, no, I haven't moved at all. Any movement is painful. We go through this, and I have a number of patients who have been able to use this combination. Initially, visualize it, they identify some relative with whom they'd want to start that, they'd want to do it for a couple of minutes initially, and I tell them to pace so that you start deliberately. For the first week, you only do it for 1 or 2 minutes at the most, and then gradually increase it. I have a number of patients in whom that has made a difference. Now, does it work in everyone? That's been the challenge. As I said, it's a hard nut to crack because some people do find it difficult to make that change. But the science actually says that when you think about it for the first time, the visualization, that starts in process new nerve circuits to be formed. When you do it for even a minute or two, that actually reinforces the circuits. If you do it maybe a few hours before you sleep,
So these are the neural pathways that you're
these are the
talking about
neural
when you
pathways. Yeah. Because
so this
ultimately, any
is
movement you do is actually going to trigger a new nerve circuit. And what helps you maintain any movement, whether you go to the gym or whether you want to go walking with your husband or partner or your friend, all of those are habits. And habits are essentially neural pathways that have become circuits that play off so that your habit becomes a routine habit. Brushing your teeth in the morning, that's a habit.
you said something that was a real standout for me, and I want to revisit this. Is you said a lot of your patients are afraid to do something because they're afraid of the pain, and this was a huge thing for me. And one of my many ahas through this was one is that pain doesn't equal harm. And when I had that realization, it changed everything for me. And I feel like this is something that I want to share with every one of you that is listening, that pain does not equal harm. And that anytime we do something as a chronic pain survivor, I would say, oh my God, like even if it was just a walk, the pain or the tightness in my legs, or, doing Pilates. And I would be in a panic and working with my trainer and say, no, I think I just did something because this hurts. And when I then realized or read that pain does not equal harm, because every time I did that, I thought, oh my God, I've just done something. And then I would spiral. In my head, I would realize as I became more aware of what my internal dialogue was, I would do something that hurt or felt like a pull or would burn or, something like that. And I go, I've done it. I'm not going to be able to get out of bed. I've just lost the next 3 days or a week. And it was kind of this, oh no, panic. And I would feel like this intensity in my body, right? Like everything was kind of focused on this area. And one of the amazing things that I've been practicing, and I even did it this weekend. I played tennis for the first time in like 6 years. And I said, all right, I will hit the ball, but I am not running for the ball because I am scared that I'm going to throw my back out. I would start to feel something in my leg or in my arm or my back because I was braced, because it's my back and neck and legs, which are my issues. And in that moment, when I would feel that, I would say, I'm safe. I'm safe. I'm safe. You're okay. You're okay. You're okay. And I would just repeat that in my head and I would feel it go away. And I would say to myself, it's okay to feel. It's okay to have burning. It's okay to have aching, because that's what working out does. But it's like this different language that we start learning as a chronic pain person, where any kind of pain represents danger and injury. And all of a sudden, when I realized that I needed to teach myself a different language or translate what was coming in as pain, I needed to be so mindful and so aware to translate that as this is normal. This is what it feels like when, if you're healthy and have no issues, it hurts to go to the gym. It feels sore. It feels tight. Because those are like the healthy things. But when you have chronic pain, those are all the things that freak you out and make you think that you're never going to be able to move again. So
You've captured that exactly, Blair. I couldn't have said it better. And in a way, part of that exercise mindset that I spoke about, while I've mentioned the things that people can do, you've actually articulated the important things that people have to do first before they get ready to do the things that I talk about. So you're absolutely right that first of all, having that conviction in your head, that voice in your head that says that you're not harmed yourself when you feel a flare up of pain, that's so important to get that feeling firmly within you. And I think when I reflect back on why many of my patients are not able to do the techniques that I've asked them to do, the visualization, the various ways of building the nerve circuits, I would have to say that it's because they have got worried that when they start doing the movements, they felt something go and they have not been able to reassure themselves effectively that it's okay to feel, that it's okay to have that sensation,
I
and that
think
hurt does not equal
I
harm.
think we should say here and now that the mantra, literally the mantra that every pain doctor should be giving their patients is, pain does not equal harm. You are allowed to feel pain. You have not, as long as you haven't torn anything or broken anything, you are safe. And it is
Absolutely.
just um, like getting to know this sensation again in context of safety. So, like, we'll know, if you feel like a tear or a sharp, sensation, like, that's one thing. But for those other things, the tightness and the soreness, like, those are sensations that we have to really initially learn to embrace and coincide with words of safety, and this is okay, until we create that new neural pathway.
Yeah, absolutely. And I think that's the important step. And probably the fourth point or the fifth point I would have said in the things that I tell them what to do, like, the steps to do it after your suggestions of initially getting over that hurt does not equal harm as the first step there. The fourth or fifth part there is once you started doing those, the suggestion from evidence and science is that people have to do it on an average of almost 66 to 70 days, which is roughly about 12 to 13 weeks of practicing that same movement once or twice a day for it to form a new habit or a new circuit that will work more efficiently instead of the old circuit which would not want you to move at all. So that means that whatever movement practice that they start, for it to feel safe and normal and habit like, can take anywhere. The average I said was 12 to 13 weeks. There are the lucky ones who can sort it in 3 weeks, and there are the ones in whom it can take up to 8 months. So the aim is that it needs to have the patience, and they need to be telling the mantra every time, as you said, hurt does not equal harm, when it can take much longer to settle.
And it's not something that you have to do every day, is it? It's like if you commit to taking a walk 3 days a week and you start to feel tight, you can just say to yourself, I'm safe. Or if you start taking a Pilates class and make sure that you're with an instructor
Yeah.
who is um, like more specialized in the body or works more closely with people who have previous injuries or who have chronic pain, that those are, also another situation where you will feel safer because you feel like you're with someone
Yeah.
a little bit more specialized with, within the studio that you go to or whatever. But it doesn't have to be every day, right? It just has to be whenever you're doing it, to just be aware, and probably just in general having that shifted mindset of
It is. I think that is out. I can't give an evidence based answer to say that you have to do it 2 or 3 times a day. I don't think that evidence exists right now. So I think I would agree with you that whatever routine we pick up to do, whether it's twice a week or once a week or 3 times a week, that repetition of the mantra is important, that hurt doesn't equal harm. But we can't know for sure how long it would take for it to become second nature, as it were. It might be taking longer, it might take shorter, but the aim is that you get into that new healthy habit. You aim to do it at the frequency you started it, and you want to do it safely and supported. And every time you do feel a flare for something else, then you do need to remind yourself of that response and then get back on the horse again and do it. And this is where it gets a bit complex because people can have a flare up for a variety of reasons. People can have a flare up because they've lost their sleep that previous day because of something else that's happened. They might have taken a red eye flight and become jet lagged, and that might be enough for the nervous system to go off. They might have had a stressful day at work or a very long drive, and any of those factors can change that delicate ecosystem balance which the nervous and immune system has established. So it's often very difficult because people might say, I didn't do anything. All I did was just take a nice flight and I've come to a holiday here. And then the pain flare happened. But that's the challenge. It's always going to be complex. When a flare up happens, it's going to be tricky to be absolutely precise and say, this is what caused it. What's important to remember at that time is hurt does not equal harm. And therefore, what can I do to reset the system again and double up on those routines that you practice? That's the important message.
So let's um, come up, with some examples of, because it sounds like it's inevitable, right? We're going to have flare-ups
Yeah,
because we're going to have life to live and we're going to have stressful events. So while hopefully the takeaway from this is um, that chronic pain is no longer like a death sentence, which it really felt like it was. It robs you of your life and your activities. One of the things that I was saying is one of the biggest things that it did is that it separates us from ourselves. We
absolutely.
turn against ourselves, we turn against our bodies, because our body's supposed to protect us, right? And all of a sudden we feel like, why is our body doing this to us? And you said so perfectly at the beginning, it is our body trying to protect us. It's just like I said in the opening, we've just got the wrong set of instructions. And so you've walked us through these new instructions that we need to give ourselves, that we can break chronic pain by remembering hurt does not equal harm, that we need to be mindful and connect the dots of, it's not just about our bodies, it is about like how we're moving through the world. And we need to, if we want to make it an everlasting, ongoing, um, improving scenario, it's not going to be about the pill, because that's not what this podcast is. This is about leaning in and doing the work.
Yeah,
And research is showing that it's only going to work, that pill is only going to work if you have tissue damage. And those of us with chronic body pain, it's generally not about tissue damage. Otherwise, it would show up. So it is about us being uh, out of whack with our stress, with our food, with our emotions, with unprocessed emotions, trauma, which is, something that we talk about a lot on this podcast, little t traumas, and
absolutely.
and uh, sleep and things like that to address it. But these flare-ups are going to happen. So when they do, what can we do in those moments to kind of recalibrate and
Yeah.
get us going?
I would say, so in my book, I talk about this part of the backpack. Like, so you have, for managing your chronic pain, you have this toolkit, which is a combination of medications, appropriate interventions, stress reduction techniques, sleep, nutrition, activity, and mind body techniques. But when you have a flare up, I have another sort of backpack that I say that we should be prepared for. Because as you exactly said, flare ups are common, they are going to happen, and they are unpredictable to a certain extent. So the sort of acronym by which I ask my patients to think about is kind of what's called the RAD technique, which is essentially one relaxation activity, one physical activity, so movement based activity, and one distraction based activity. So that is at least a set of three things that you can bring in. Of course, a question when every time a flare up happens, people will say, well, what if I've done something? And what I try to tell them is if you can find out that you don't have a fever, or you're not running a temperature, you've not got a swelling or redness around the area where you feel the pain, then in all possibility it's likely to be a flare up of your pre existing chronic pain rather than something new and physical and structural, which means that's the time to start the rad back up. And that might mean you would have to experiment to find out from your toolkit that you created for chronic pain to find out what might be a relaxation strategy. Would it be a breathing technique? Would it be a visualization technique? Would it be kind of a body scan? One of those relaxation techniques, an activity based technique. So, can it be a visualization based movement? Can it be a gentle pacing of 30 seconds to a minute? Or can it be just gentle knee flexion or, bending and straightening? Something that you can do that constitutes a little bit of movement. And then the third is a distraction technique. Again, can be music, can be something like crochet, can be something of talking to a friend or distracting yourself with something to drink or something healthy. And maybe at that point of time, it may very well be a pain medication at a slightly higher dose. If that has proven to help either in relaxation or distraction, then I say a flare up management. If a medication is part of it, I'm okay for that for a short period of time if it helps manage the flare. I think there is a deeper question to be asked, as in if people are getting flare ups every 3 or 4 days or every week, then we need to double down and look as to what might be the triggers for the nervous and immune system as a broad thing. But initial management of any flare up, one of these three strategies or all three might be required to balance and cut a flare up or at least shorten the flare up.
That's awesome. We all need to have that in our back pocket because it's coming. Just know that it's coming, right?
And it's a bit of experimentation that people would have to do. When I tell my patients, I kind of tell them, I've forgotten now with car driving in the US with the stick shift and the automatics that you have, but you got your emergency brakes. I think with the nowadays with the Tesla and the electric cars, you don't even have a proper emergency brake or a lever to pull, do you? But I often tell patients, when you learn car driving, your driving instructor often teaches you how to use the emergency brake so that you can use it in emergencies. You're often taught how to do it in an elective setting so that you know that it becomes a reflex mechanism that you can reach out to when you need it, because an accident is unexpected. You do not know when it's going to happen. So you need to have that reflex that lets you reach for the emergency brake in time so you don't do yourself further harm. And that's what I tell patients as well, as these kind of uh, flare up techniques. It's better to experiment when you're not in a flare up to find out what works for you and practice them a few times so that when a flare up happens, you can go to that technique like the body scan quicker rather than scrambling at that point of time, because it's often difficult to start something new in a flare up time.
So if I would have to imagine that, like, uh, back spasms are probably one of the most common
Absolutely. Yeah.
chronic pain things. So, I mean, let's kind of discuss that. So you're in a flare up of a back spasm. So just laying there, closing your eyes and imagining getting up easily out of bed and walking to the kitchen. Is that like what you're saying? And kind of repeat that and breathing techniques.
So It's nice that you asked me that, Blair, because just 2 days ago in my last clinic, I had a patient who exactly asked me that question. And I think for, was it a neck or a back spasm? That's it. And I said, look, when you get the next back spasm, at least what you do is wherever you are, see if you can get a safe place to sit down or lie down if you can. Close your eyes. First of all, start a breathing technique. Now that can be the a box breathing technique. So you kind of close your eyes and you imagine that you have a rectangle or a sort of square box. So you could breathe in as you imagine yourself going on that sort of box, breathe out as you go along the upper part of the box, and breathe in again when you come down. So you can do the box breathing, or you can do the technique of what's called a 3-4-5, where you breathe in for 3 seconds, you hold for 4 seconds, and you breathe out for five
Is
seconds.
that all through your nose, or
So breathing in through the nose, but the breathing out can be through the mouth as well. Usually through the mouth is easier when you're doing a longer breathe out. Breathing out through the mouth is easier, but that allows you to focus on the breathing, takes the mind off the spasm bits there. And the visualization is the next step after the breathing
and
technique.
that calms the vagus nerve?
Exactly. So that's a form of waggle thing. One of my physios teaches this technique of using his hand, and he kind of says, if not anything there, just see as you breathe in, as you go along your thumb, and you breathe out as you come down. Then you feel. So he incorporates the element of actually refocusing on your hand, breathing in, so you're using touch of the hand as another technique. So you breathe in as you climb up the finger, you breathe out as you breathe come down the finger. And this itself, when you do that slow part there, that activates your vagus, is uses touch, it uses a refocusing element and distracts because you're focusing on a hand. So those are all ways of managing. And then I tell them, ensure you're well hydrated. If you do need a muscle relaxant or something, and that's something that has helped in the past, that might be the reason to take a medication in that bit there, and focus on what might have been, after the past, after the event has passed, to think about what might have been the thoughts that were going on or the movement that you did when that spasm started. Those could be reflected afterwards. But in the acute flare up, a relaxation technique, a touch based movement technique like that, and a distraction technique that's there could just be the right spot to do.
We will, in the notes from the show, we will have uh, your book, which I thank you for writing it. You've you've done the world a tremendous service with this, so thank you for
Thank
that,
you.
and thank you for being with us today. And I hope that you will come back, because I think that there's so much more to talk about. And I hope that this is the last time that you'll be with us.
No, thank you, Blair, for having me. And absolutely, yes, I think I wish the very best for you, for the podcast, for what you're starting to do and doing for yourself and your community. And I'm glad that I've been able to provide some value today. So thank you. And I look forward to coming back on it at a later date with more new information, hopefully.
Wonderful. Thanks.